Hello everyone. In this part, we're gonna talk about the upper arm anatomy. There are the structure of the deltoid, biceps, tricep, and lateral epicondyle bone. In the upper arm, the deltoid muscle is the largest muscle of the shoulder, which shape is triangular shape, as you can see. The deltoid muscle lies over the glenohumeral joint and gives the shoulder its rounded contour. There are three parts, which are anterior part, middle part, and posterior part. It originates from the lateral part of the clavicle as well as spine and acromion process of the scapula. These three parts of the origin go along with the arm and insert at the deltoid tuberosity at half of the humerus. The actions of the deltoids are flexion, internal rotation, abduction, extension, and external rotation of the shoulder. The biceps brachii is a biarticular muscle which is the anterior compartment of the upper arm. It originates from supraglenoid tubercle of the scapula and coracoid process of the scapula and inserts at the posterior border of the bicipital tuberosity of the radius and bicipital aponeurosis to the deep fascia and subcutaneous ulna. The action of the biceps brachii are supinated forearm, flexes elbow, and weakly flexes shoulder. Triceps brachii is a large three-headed muscle of the posterior muscle group of the upper arm. The triceps brachii arises from the scapula, the humerus, and the infraglenoid tubercle, and it inserts onto the orecranon process of the ulna. The main function of the triceps brachii is extension of the forearm. The long head of the triceps brachii participates in both extension and adduction of the upper arm. The two ends of the humerus are medial epicondyle and lateral epicondyle. Lateral epicondyle of the humerus is a large tuberculate eminence, curved a little forward and giving attachment to the radial collateral ligament of the elbow joint and to tendon of supinator and some of the extensor muscles. Well, that's the overall of the upper arm anatomy. When it action, the whole arm is moved, and the places that you must be careful because it is very sensitive are the axilla and the olecranon, which is behind the elbow, lower arm and hand, which is a part of muscle and bone. Okay, let's start. There are two bones of the lower arm, which are ulna and radius. Ulna is a long bone in the forearm, located at the medial side and parallel the radius, and radius located at the radial side of the lower arm. Distal radio-ulnar joint is located just proximally to the wrist joint. Next to the distal radio-ulnar joint is the group of 8 small carpal bones, and then there are the metacarpal bone phalanges, which are the 3 bones in one finger, except there are only 2 phalanges bone in the thumb. The flexor group of the lower arm originates from medial epicondyle of the humerus and confined to radius and ulna. The flexor group goes along lower arm and crosses the wrist joint to attach at at metacarpal and phalangeal bone. The extensor group of the lower arm located at the posterior side. It originated from shaft of the radius and ulna and cross the wrist joint to insert at the metacarpal bone or phalanges. The extensor group is responsible for extension of the wrists and digits and supinate the forearm. Palmar interossei are a group of hair intrinsic muscles of the hand located between the metacarpals. They assist in flexion of the metacarpophalangeal joints and extension of the interphalangeal joints. So that's all about the lower arm and hand. I hope you all better understand about the lower arm and hand.